Hello everyone, I am Sneha, lecturer, Department of Vision Assistant, SNS College of Allied Science. Today we are going to see about types of incision and their indications. Introduction. An incision is a surgical cut made in the skin or body tissue to expose underlying organs, bone or tissue. Usually it is made by surgeon. Here is the image of incision. It is also called a surgical wound because the surgeon will create the wound to explore the underlying organs, bone or tissue to treat and cure the condition. Incisions are made depending on the pathology, patient's individual disease condition, and also it depends upon the surgical procedure and also patient anatomy and the surgeon preference. In the incision made depending all these conditions and according to the surgeon preference also. Types of incision we will see one by one. The first incision is midline incision. It is a vertical cut along the midline of the body. Here is the image of a vertical cut in the abdomen. It is called midline incision because it is made in the midline of the abdomen. Indications of this incision is abdominal surgeries to access the central organs like heart, liver, spleen, emergency surgeries, some spinal surgeries also performed by this incision. To visualize the heart, liver, spleen and also other structures to cure the condition and to prevent the further damage. Advantages of this surgical cut is wide exposure. We can extend the incision to easily extendable to visualize the organs. Access to multiple organs. If we made one midline incision, we will explore many organs like heart, liver, spleen. It is a easily extendable incision for the wide exposure. Next is transverse incision. It is a horizontal incision across the abdomen or body. Here is the image of transverse incision. It is a horizontal incision will made by the surgeon in the abdomen or in the body, depends upon the condition. Indications for transverse incision is cesarean sections to deliver the baby, bowel surgery such as intestinal tuberculosis, intestinal obstruction to clear the bowel and to regulate the movements of peristalsis, and also stoma formation to create an opening in the abdomen. Access pelvic or groin region to perform surgery on pelvic organs or other organs in the groin region, and it is also used for cosmetic surgeries to reduce the belly fat like that and all. Advantages of this transverse incision is less post-operative pain comparing to other incision. This particular transverse incision giving lower pain comparing to the others. Better cosmetic outcome for this transverse incision. Next is oblique incision. It is a diagonal incision which is shown in the image across the abdomen or any body part, depends upon the patient condition. Here is the image of oblique incision in the clavicle region. Indications appendectomy to remove the appendicitis and also hernia repairs, depends upon the types of hernia. Some cholecystectomies to remove the gallbladder, lateral spinal surgeries and also other surgeries like clavicle fracture fixation which is shown in the image. Advantages: good access to specific organs, less muscle disruption. Comparing to other incision, in this type of particular incision, muscle disruption is less comparing to others, and also good access to specific organs such as hernia, appendix and gallbladder. Next is paramedian incision. It is similar to the midline incision but just off the midline. Midline incision is made in the midline of the abdomen, but this paramedian incision is also a vertical incision but it is not in the midline, just off the midline, which is shown in the image. Indications: gastrointestinal surgeries, retroperitoneal procedures like to visualize the gastrointestinal structures and also kidney, bladder like that and all. Advantages of this surgery is better exposure with less damage of midline muscles. If we don't need to cut the midline, we will use this paramedian incision because it is just off the midline to expose the gastrointestinal organs and also retroperitoneal organs. It will give a better exposure with less damage. It is the advantages of this particular paramedian incision. Next is laparoscopic incision. Small incision for minimally invasive instrument incision will be placed, which is shown in the image. We will create a small port around the abdomen to visualize the abdominal organs. Here is the image of laparoscopic incision. Indications: laparoscopic cholecystectomy, laparoscopic appendectomy, bariatric surgery, diagnostic laparoscopy. These are all the conditions performed by the laparoscopic incision. In laparoscopic cholecystectomy, we will create these small ports in the abdomen and to visualize the gallbladder and to remove the gallbladder. As well as appendectomy, in laparoscopic appendectomy, we will create port similarly and also to remove the appendix which is inflamed. Bariatric surgeries to reduce the diameter of the stomach to reduce the obesity and all. Diagnostic laparoscopy, this will also perform for diagnostic purpose also. We will create port and insert the laparoscopy to visualize the affected organs. Then we will take some biopsy and all. We will send to lab to confirm the particular condition or disease.